friends, welcome to my channel Healthy World. Today I will speak about muscular dystrophy.
Muscular dystrophy is a group of inherited disease that damage and weakens your muscle over time. This damage and weakness is due to lack of protein called dystrophin, which is necessary for normal muscle function. The absence of this protein can cause problems with swallowing, walking, and muscle coordination. Muscular dystrophy can occur at any age, but most diagnoses occur in childhood. Most common in boys. The prognosis for muscular dystrophy depends on the type and severity of symptoms. There is no known cure for muscular dystrophy, but certain treatment may help. Types of muscular dystrophy: Duchenne muscular dystrophy, Becker muscular dystrophy, congenital muscular dystrophy, myotonic dystrophy, facioscapulohumeral muscular dystrophy, limb-girdle muscular dystrophy, oculopharyngeal muscular dystrophy, distal muscular dystrophy, Emery-Dreifuss muscular dystrophy. Duchenne muscular dystrophy. More among children, boys especially. Symptoms: trouble working, loss of reflexes, difficulty in standing up, poor posture, breathing difficulty, swallowing problem, lung and heart weakness. These people typically require wheelchair. Life expectancy is late teen or 20 years. Becker muscular dystrophy. Less severe, mostly affect boys. Muscle weakness occur mostly in your arms and legs. Symptom appears between age 11 and 25. Some symptoms are walking on your toe, frequent fall, muscle cramp, trouble getting up from floor. Usually require wheelchair after mid-30s. Congenital muscular dystrophy. Often apparent between birth and 2 years. This is when parents begin to notice the child's motor function and motor control aren't developing as they should. Symptoms are muscle weakness, inability to sit and stand without support, foot dysformities, trouble swallowing, respiratory problems, vision problems, speech problems, and intellectual impairment. Life expectancy varies according to symptoms. Myotonic muscular dystrophy. This causes myotonia, which is inability to relax your muscle after they contract. This affects facial muscle, central nervous system, heart, thyroid, eyes, adrenal gland, and gastrointestinal tract. Symptoms most often appear first your face and neck. Symptoms are drooping muscles in your face, difficulty in lifting your neck, difficulty in swallowing, drooping eyelid, early baldness in the front area of your scalp, poor vision, weight loss, and increased sweating. Male may cause impotence and testicular atrophy. Female may cause irregular periods and infertility. Diagnoses are most common in adults in their 20s and 30s. Facioscapulohumeral muscular dystrophy. Affects the muscle in your face, shoulder, and upper arm. Symptoms are difficulty in chewing or swallowing, slumted shoulder, a crooked appearance of mouth and a wing-like appearance of shoulder blades. Symptoms usually appear during teenage years. Most people with this condition live a full lifespan. Limb-girdle muscular dystrophy. Causes weakness of muscle and loss of muscle bulk. Usually begins in your shoulder and hip, but can also occur in your leg and neck. Symptoms are hard to get up from chair, walk up and down stairs carrying heavy items, stumble and fall more easily. Most people are disabled by age 20. They have normal life expectancy. Oculopharyngeal muscular dystrophy. Causes weakness of your facial, neck and shoulder muscle. Symptoms are drooping eyelids, trouble swallowing, voice changes, vision problem, heart problems, difficulty walking. Diagnosed in 40s and 50s. Distal muscular dystrophy. These affects muscle in your forearms, hand, claves, and feet. Can also affect respiratory system and heart muscle. Symptoms are loss of fine motor skill and difficulty breathing. Diagnosed in 40s and 60s. Emery-Dreifuss muscular dystrophy. Affects more boys than girls. This type of muscular dystrophy begins in childhood. Symptoms are weakness of your upper arm and lower leg muscle, breathing problems, heart problems, shortening of the muscle in your spine, neck, ankles, knees, and elbows. Individuals with this dystrophy dies in mid-adulthood from heart or lung failure. How is muscular dystrophy diagnosed? Test your blood for the enzyme released from damaged muscles. Test your blood for the genetic marker of muscular dystrophy. Perform an electromyography test on your muscle's electrical activity using an electrode needle that enters your muscle. Perform a muscular biopsy to test a sampling of your muscle for muscular dystrophy. How is muscular dystrophy treated? There is no cure for muscular dystrophy, but treatment can help manage your symptoms and slow the progression of the disease. Corticosteroid drugs help to strengthen your muscle and slow muscle deterioration. Assisted ventilation, if respiratory muscles are affected, medications for heart problem, surgery to help correct the shortening of your muscles, surgery to repair cataracts, surgery to treat scoliosis, surgery to treat cardiac problems. You can strengthen your muscle and maintain range of motion using physical therapy. Occupational therapy can help in being more independent, improve coping skill, improve your social skill, give access to community services.
Thank you friends. This is all for today. Please like, share and subscribe to my channel and do comment.